is your life follows your thoughts. If it is to be, it's up to me. My brother used to tell me this all the time. He was in the Army, and he used to always make me repeat after him, like in the Army, like, if it is to be, it's up to me. It's up to me. He used to make me do that as a kid. I always remember this, though, so it stuck with me. Okay, today we are going to pick up with chronic inflammatory bowel disease. Let me just preface this by saying, we are going to talk about this disease numerous times. It's the same disease that occurs in the stomach, the small intestine, and the large intestine. It's inflammatory bowel disease. It's usually caused by some kind of chronic inflammation where the immune system starts overreacting to it. The reason I'm telling you this is because we already talked about it in the stomach on Monday, and we're going to talk about it twice today, because right now it's in the small intestine. I'm going to mention the same thing when we get to the large intestine. Please just understand, don't learn those as different diseases. They're kind of all the same thing. So the same thing, chronic inflammatory bowel disease, commonly seen in dogs and cats. And the problem is, there is chronic inflammation in the intestines. What causes it? It could be diet, it could be bacteria, there could be lots of causes. The causes are variable, but what we know is the immune system is becoming inflamed, and we wind up getting inflammatory cells in the intestinal tissue. When we have so much inflammation in the intestinal tissue, it damages the intestinal tissue, and it results in these clinical signs. Vomiting, diarrhea, they might start losing weight, they might have borborygmus. What's that? What's borborygmi? Gut sounds. Borborygmi are like gut sounds. So if anybody's ever heard their dog laying down and you hear them like, that's borborygmus. Or you've heard your own stomach do that? Y'all, borborygmus. So that's if their stomach is kind of upset. They might have halitosis, bad breath, or flatulence, a lot of gas. Chronic inflammatory bowel disease. And this is just a picture of what it looks like. This is the normal intestinal wall with the villi. But when it becomes really inflamed, we get all these inflammatory cells. And those inflammatory cells damage the mucosa, cause them to be leaky. That's how we get those clinical signs we just mentioned. So we also mentioned in the past how to treat this. Well, first let's talk about how to diagnose it. History and physical exam are going to help us, because usually this is an ongoing problem. The animal has chronic diarrhea, chronic vomiting. Now they're losing weight. And remember, maybe we tried everything. Remember I told you guys about that case where I changed the diet. Then I tried metronidazole. Then I tried prednisone. You have to try numerous things. When those things don't work, we might get to the point where you say, you know what, everything that I've tried is not working. Let's biopsy. Let's take a piece of the intestine, send it to a lab, and they can tell us what's going on. So let's biopsy to identify the lymphocytes and the plasma cells, the inflammatory cells in the intestinal tract. If we diagnose the animal with inflammatory bowel disease, to treat it, what are we going to do? Decrease the immune system response. Put them on immunosuppressants. So you guys might remember that. We talked about it before. Prednisone, azathioprine, metronidazole. These are all drugs that might help to decrease the inflammatory response, also help to normalize the bacterial flora. So that's how we're going to treat this disease. It's just like when we talked about immune-mediated inflammatory bowel disease in the stomach. Everything's pretty much the same. Now we're just in the small intestine. Any questions about that? We've mentioned all of these drugs before. I don't think any of them are new. The diagnosis is the same, because that's all I have on that disease. I'm going to move on to the next one. The next one is intestinal lymphangiectasia. That's how you say that, intestinal lymphangiectasia. What happens here is the lymphatic system is not functioning correctly. The lymphatic system does not drain fluids appropriately, and so we get fluid that gets released into the intestinal lumen, and that causes diarrhea, it causes loss of protein, loss of fluids, inflammatory cells. So this is really a problem with the lymph system, and because it does not drain well, we get all this fluid buildup. And something else I want to mention here. When an animal loses a lot of protein loss can equal things like edema, effusion, and ascites. Have you guys learned in ClinPath yet about the blood proteins like albumin and blood proteins? Okay, you may not have gotten there yet. In the blood, there's proteins that help hold fluid in. If we lose those proteins, fluid will start to leak out. And so in this disease, if they start losing a lot of protein, fluid will start to leak out into the tissues, into the abdomen, into the chest. And that's how we get edema, effusion, ascites. Hydrothorax is water in the chest. It's kind of like when we talked about FIP and we said the vessels get leaky and they leak fluid out. It's kind of the same thing here. Because there's no protein in the blood vessels, here the lymphatic vessels to hold the fluid in, we start getting fluid leaking out, okay? And that can cause diarrhea and weight loss. Yeah.
Are you going to have vasculitis or just...
Not so much vasculitis, since this is only because this is not so much the blood vessels, but the lymphatic vessels. Okay. So usually when we say vasculitis, we mean the blood vessels, right. And here it's lymphatic vessels. But yeah, think inflammation of lymphatic vessels. Yeah, but yes, it's something. Okay, so everything's kind of leaking out. Now this one doesn't end so well. I know I say that. So, the diagnosis. Blood work can help because sometimes what we'll see is a low protein on blood work because everything's leaking out. And biopsy, the same thing. We need to take a sample of the small intestine. They're going to biopsy it, and they're going to tell us that the animal has lymphangiectasia. So the treatment, what we're trying to prevent is a loss of protein. So we try to keep the animal's protein levels fairly high. So we want to choose a food that has less fat and high quality protein. Less fat and high quality protein. Certain drugs may also help. Prednisolone, which is a steroid like prednisone, and metronidazole. These drugs will help to control the diarrhea and the inflammatory response. Unfortunately, there's no cure for this disease. Most of the time, the animals will succumb to their protein loss. So most of the times they'll lose so much protein that they become debilitated, they lose weight, and they may either die on their own or have to be euthanized because of this one. That's unfortunate, but this is intestinal lymphangiectasia. Question about that one. Intestinal lymphangiectasia. So just look at the term lymph and just understand that the lymphatic vessels are not flowing well, so they start to leak fluid. Now we're going to do intestinal neoplasia. So this is going to be very similar to what we talked about in gastric neoplasia. Now we're just in the small intestine. And these are the same two tumors that I mentioned in gastric neoplasia. Try to remember, when we talked about gastric neoplasia, I told you adenocarcinoma was more common in dogs, lymphosarcoma is more common in cats. In the intestine, it's not necessarily the same. Dogs or cats can get either one of these. But adenocarcinoma is a malignant tumor of glands in the intestine. Lymphosarcoma, same thing, a malignant tumor of the lymphatic system. So clinical signs. The clinical signs are going to be related to where the tumor is and how advanced it is. If the tumor is so big that they are not able to digest food well, they might lose weight. It might cause abdominal pain. It could cause bleeding in the small intestines, which we're going to see as melena. It could even obstruct the GI tract. So it just depends on the tumor and how big it is. In a few slides, I'll have a picture of intestinal tumors and you can kind of see what that would be like. So usually, how are we going to diagnose this? Well, remember, the animal's not going to come in saying, I have intestinal cancer. It's going to come in with certain signs like weight loss, maybe vomiting or diarrhea. There's going to be some signs that there's a GI problem. So the veterinarian is going to do an exam. They might be able to palpate this. If we are really good at palpating and the animal will tolerate it, sometimes we can palpate a mass in the abdomen. We can do x-rays to look for a mass. If we do find a mass, we need to biopsy it so that we can get a diagnosis. Blood work is just going to be supportive. Blood work is just going to say, hey, do we have any liver, kidney damage here? If we do have a tumor, the best thing to do is surgically remove it. That's the best thing to do. Chemotherapy may help as well.
Dr. Deb, they wouldn't have any type of anemia?
They might. They might, yeah, and that's what blood work is just going to be supportive, because anemia can be caused by lots of different things, right? But certainly a dog with cancer could be anemic, anemia of chronic disease. Yep. So this is an intestinal tumor. So this is all normal intestine. This is the normal size of the intestine. And then here you get this big tumor here. And as you can see, food is not going to be traveling past that. And ideally, we would take a biopsy of that to see if it's cancerous, see if it's spread, if it's likely to spread. But if we can take that out, animals can live nice, healthy, normal lives without much intestine. Like you could take feet of an animal's intestine and they can still do well. Could they have a little bit of diarrhea because we've taken so much of their intestine out? Yes. But in this case, where it's a tumor, we could resect a part of that small intestine and they could go on, you know, assuming the tumor is not already affecting the rest of the body, they could go on to live nice, healthy lives. But this is what it would look like. This says severe distension in a segment of the jejunum in the site of an obstruction anterior to this point. So they're just saying there's an obstruction here, and so you can see how severe this segment is distended. But how do we figure this out? If this is cancerous, this is a picture of biopsying the small intestine. So here, this is not a cancerous site, but here's normal intestine, or what looks normal. If we needed to take a biopsy, the surgeon will take out the piece of intestine, put it on a sterile piece of cloth, and take a biopsy punch. This instrument is called a biopsy punch. You just twist it down, and this edge has a cutting edge, and you just twist it in, and it cuts out a little core piece of tissue, and that's all that takes. You send that into a lab, and the lab will say, hey, we found inflammatory cells, or we found cancerous cells. So this is what it looks like if you needed to take a full thickness intestinal biopsy. It does. It'll go all the way. It'll go as far as this metal piece. So as far as you stick it down, it'll go all the way up to that, to the hub of that, and it'll give you a core about that size. And you can get them in different sizes too. Huh? And then you have to sew the hole back up. Yeah, exactly. We'll have to sew that hole back up, and it's not too big. And it'll heal up really fast because it's a mucosal surface. Really fast. So if we decide that an animal has intestinal neoplasia, the prognosis is poor. Animals may live up to about 2 years after we diagnose them. If it's a cat that has lymphosarcoma and they have chemotherapy, again, maybe up to 2 years afterwards. So long-term prognosis is not good. Maybe we can buy them a couple of years with aggressive treatment, surgery, and chemotherapy, which is very much like gastric neoplasia. Long-term prognosis is poor, but we could try to treat it. So as you're studying, try to look at the similarities between the diseases, and then you know, make some connections so you don't have to restudy everything over and over. Now the next thing is going to be exactly what I've already talked about twice before, because now we're moving on to the large intestine. See, it's going to say diseases of the large intestine, and the first one I'm going to talk about is inflammatory bowel disease of the large intestine. It's exactly the same, just in the large intestine. So the function of the large intestine is that's where we reabsorb water and electrolytes. So as our body is making excrement, making feces, and the animal's body is making feces, it's in the large intestine that we reabsorb some of those things that we want to keep inside the body. So when we have inflammatory bowel disease in the colon, we get sometimes a loss of that fluid and electrolytes. So we get diarrhea with more mucus in it, more frequent defecations because it's all happening in the colon, so they have smaller amounts but more frequent. Tenesmus, this is straining to defecate because they always feel the urge. It's like they always feel the urge, so they're always like squeezing to go, but not a whole lot comes out. Not a whole lot comes out. And how do we diagnose it? The same thing. An animal that has these signs, we need to rule out parasites. Let's make sure that they don't have parasites. Make sure that they don't have any other illnesses like liver, kidney disease, pancreatitis, you know, bacterial overgrowth. We can do cytology. But the way to diagnose this is to biopsy the large intestinal wall. Whenever you see LI, that's for large intestine. We're going to biopsy the large intestinal wall and look for the inflammatory cells. We've said that before, the same thing in the stomach and the small intestine. Treatment, Same thing, we've talked about it before. Change the diet. Try drugs that are going to decrease the immune response. Prednisone, sulfasalazine, and metronidazole are antibiotics that have anti-inflammatory effects. Mesalamine is kind of a metabolite of sulfasalazine, they're related. So we've talked about this before. You're just going to try changing the diet. Then you're going to try adjusting medication, maybe deworming just in case. The same thing for clients, same thing. The treatment can be lifelong, often prolonged. We're never going to cure them probably, but we can control the symptoms. And maybe if they have flare-ups, then you just kind of treat the flare-ups. Okay? But take them outside, they may have to go to the bathroom pretty frequently. So same disease, just lower down in the GI tract. Now the next one is pretty interesting disease. Some people have trouble saying that word. It's called an intussusception. Anybody heard of that? You ever learned that? Intussusception. I'm not sure if you've heard the term or learned it anywhere. Usually this is a disease that happens when the animal has some kind of pro-motility disorder, right, where maybe they have diarrhea and actually the intestines are moving too fast. So you know those little toys that they kind of invaginate on each other? It's like a water thing. It's like, and as you squeeze it, you can make it invaginate on itself. I don't know if any of you play with it. That's what this disease reminds me of. You know that little squeezy toy?
Yeah.
So imagine the intestines being really kind of motile, meaning they have increased peristalsis. Sometimes one part of the intestine swallows the other. It like kind of invaginates on itself. And here's a drawing of it. See how this part of the intestine starts to swallow the other one? Or maybe this part of the intestine starts to swallow the other one. And then it looks like this in real life. It looks like an intussusception. You can see this piece of the intestine is stuck inside that one. And when that happens, unfortunately, food can't pass through there. It kind of creates an obstruction, and then food can't pass. And this can happen because they have parasites, they have a foreign body, infection, or cancer. What the problem is, there's something that's making the intestines work harder and work faster, and it's like a mistake. It just kind of goes, oh, I'm swallowing this part of the intestine. They may have vomiting and diarrhea with or without blood, anorexia, and depression. I saw a case of this here. It's actually Dr. Mendoza was at the farm, and the farm has lots of Great Pyrenees, and the Great Pyrenees just keep reproducing. So they had this litter of puppies. One of the puppies kept getting sick. And Dr. Mendoza and the students dewormed it, and they gave it fluids and antibiotics. And they thought, well, maybe it's parvovirus because it was a puppy. It was having vomiting and diarrhea, and it was just so lethargic. And I even went out with him to the farm to take a look at this puppy. But by the time I went out there, the puppy seemed a little bit better. He was like, well, it looks a little bit better. Unfortunately, the strange thing about that is it passed away the next day. The day that we thought it looked better, the next day he went to the farm, it had passed away. He brought it in here. We did a necropsy. And the intestines were necrotic. They were black. And there was an intussusception. Not just one intussusception. It was like 3 times invaginated on itself. So imagine this part had swallowed this part. And then another part swallowed that part. And then another part swallowed that part. It had just created this big mass of invaginated tissue. And it had become black in the necrotic. So when we opened the intestine, this section was just black. So probably the puppy died from septicemia, from necrotic tissue. And it had intestinal parasites, so we also pulled out brown worms, like these long worms. We pulled out these spaghetti-like worms. And we think he probably had this kind of hypermotility disorder because of parasites, and it just kept invaginating on itself. That was the last time I've seen one. I saw also one in a shelter, very similar situation. We were confiscating animals that were being abused, and one of the puppies died from intussusception.
So could you see this in a radiograph?
You could,
Okay.
you could. If you catch it early, you can see it on the radiograph. Sometimes you can even palpate it. You'll just palpate like a thick mass. It'll feel like a mass in the abdomen. And maybe you could say, that might be an intussusception. I have repaired one in surgery, and also a puppy that ate its collar and its rabies tag. It was a puppy that was known to eat things. It had just had a surgery like 6 months before because it had eaten something. Came to me on emergency clinic. It had eaten its collar and dog tag. I go in, and it had an intussusception. And thank goodness I went in, because now I could take it apart, We took out the dog tag and pieces of the collar, and at least we fixed that intussusception. So what happens is, once they're in an obstruction, the collar was in the intestine. And so the intestines are trying to pass it, but because it can't squeeze it, this part of the intestine winds up going over it. You know what I mean? Like it's trying to push it, but it just can't, so it goes over it. So we were able to get the collar out, stop the intussusception before it created an obstruction, and hopefully that dog didn't eat anything else anymore. But yeah, if you catch it soon enough, you can just separate the parts, treat whatever's causing it, take out the foreign body or treat the intestinal parasites, and hopefully you can stop the, the aggressive motility part. So,
if you catch it soon enough, you don't have to cut it out or anything.
Correct.
You can just stretch it back out.
Yep, exactly. And as long as you treat the condition that caused it, then hopefully it won't do that again. So, yeah, if you can. But if you leave it, sometimes inflammation will create there, and then it'll seal. So that's what happens. It'll create friction, and it like seals it, and then it almost like heals that way. And then you have to like break it down to spread it out. If you catch it early, you just pull it out. But that's what the diagnosis is: palpation of a sausage-like mass in the cranial abdomen. So usually kind of up in where the small intestine would be. So if it's bad, let's say if it's necrotic, then we would try to take out the necrotic bowel and just put them on fluids. Make sure we provide adequate nutritional support afterwards. Maybe don't feed them for a day or so, and then wind up feeding them a bland diet. So recurrence is infrequent. So once we separate it, we treat the cause, the chances of this really happening again is infrequent. It's possible, but infrequent. Prognosis depends on the amount of bowel that you have to resect. Puppies should always be treated for parasites to prevent this. I like this next picture. It's just a closer up picture so you can see kind of what's happening. You can see how this part of the intestine has swallowed this part of the intestine and how it can get stuck like that. But if you catch it soon enough, you just separate those parts. Take out whatever the foreign body is, or treat for parasites. But that's what an intussusception looks like. So again, we could palpate that. We might be able to palpate that and diagnose that before it gets too late. Intussusception. Megacolon. What does that sound like? Large colon. A large colon. Which may not seem like a bad idea until it gets so big that all the stool just stays there. This is uncommon in dogs, but I have seen it in cats several times. Unfortunately, I have a story that happened recently where a lady found a kitten, and the kitten's abdomen was about this big. I mean, it was just huge. And when you palpated it, it was tight, but there was so much stool. I mean, you could just feel the stool in the colon. It was just humongous amounts of stool. But part of the problem was this kitten was strayed and had been eating things off the street. So it had been eating just anything it could find, and now it almost had kind of like an obstruction in the colon. So what we had to do, let me tell you about what happens in megacolons. Usually it's some kind of intestinal obstruction, severe constipation where they can't go, they can't defecate. So they'll be straining to defecate and they can't. Sometimes it's because the colon is so big, it stretches out the nerves, and now the nerves don't work anymore. Imagine your colon being so big that the nerves are deadened. It's, like when your leg falls asleep.
Yeah.
Imagine your colon falling asleep, and now it's just so tight. And now it doesn't work. It'd be like when you stand up, your leg falls asleep, and you stand up, and it goes like this. That's happening in your colon. You want to go to the restroom, but you can't because the nerves are kind of deadened. And you try to go, and you can't. So what happens here is the stool stays in the colon, and it dries out. Why? Because in the colon, we absorb all the water out of our feces, or a lot of water out of our feces. So now the stool is hard, maybe small if you can get it out, but usually it's hard. There may be a large amount stuck there. There may be blood or mucus in it, but this is what it can look like on radiograph. I know it's hard to see, but the colon is this big.
Whoa.
Wow.
We know that's too big because we can measure it. The width of the colon is greater than the length of a vertebrae. So the vertebrae are only about this big each. But the width of the colon is like 2 times that. So if the width of the colon is bigger than the vertebrae, something like that, then you know it's megacolon. That's too big. That's too much feces in there. And look how it just looks like rock. I mean, doesn't it just look kind of like dry, and it doesn't look like it's going to come out nice and soft. So the animal's going to be straining. They can't get it out. It's too dry, and it just stays there and stays there. And so with this little kitten that I saw with this, we gave it an enema to try to massage it, and get it all out. It was really hard to get out, poor thing. It was very painful for the kitty, but we had to do that for a long time to try to get it out. So I think the kitten is doing okay, but still, it took us a long time. It was just, unfortunately, it was just kind of painful for the cat because it's so dry, and we're having to try to manually get that out. But that's megacolon. And sometimes it requires surgery to take out. So diagnosis, we palpate it. We can take radiographs, or we can literally do digital palpation, stick our finger in the rectal opening, and we can feel the hard, dry feces. This is what we did for the kitten, a warm water enema. You can just use regular soap too. You take warm water, mix it with soap, put the soap in the rectum, and that breaks down just like soap. It breaks down hard things. And you wait till it gets soft and mushy, and you can kind of milk it out. Milk it off. It can be painful, but it can help. Anesthesia can help. This kitten was too young to anesthetize. It was like this big. So we didn't anesthetize.
Wouldn't this soap burn?
No, because it's just like hand soap. Just like hand soap. So it's very mild. It's very mild. It doesn't burn at all. You can use warm water. You can use soap. You can use, what else have we used? That's usually what we use in practice. Regular old hand soap. And the mucosal surface is delicate, so you have to be careful. That's why it can be painful. As you're squeezing and trying to get it out, it's going to be a little bit painful to try to do that because it's just so dry. So the main thing to do is make sure animals are very hydrated. Encourage their water intake. Get them fresh water. If you have a cat like mine, for example, that has to have running water, do that for them. Feed a high fiber diet to keep everything moving. Salt food is just to make them a little bit thirsty so they'll drink more water. So it's kind of like when you eat something salty and you're thirsty, you might drink more water. I don't recommend that only because it's hard to know how much salt you're giving. You don't want to give too much salt for a long period of time. Maybe if you're just doing this temporarily, I think that's okay. But don't start putting a lot of salt on your pet's food. That can be unhealthy too. But if you need them to encourage water intake in a short period of time, I don't think that's a bad idea. That's megacolon. Hopefully you can treat it just by giving them an enema, but it could be a little bit uncomfortable. Okay, we'll stop there.